Welcome back to another episode of Healthy Happy Hour presented to you by Neighborhood Medical Center. I am Joseph Ward, and joined with me always is Mr. Matthias Sweet. What's up, Matthias?
Nothing much. How y'all doing?
Doing good out here in these healthy streets. Of course, you all know Healthy Happy Hour will bring it to you every third Thursday of every month. And if we don't bring it to you every third Thursday, just stick around because we're going to get this information to you because this is what we do. We remember our Healthy Happy Hour was an event that was created a while ago within our public health realm to better connect our resources to our communities. There are a lot of times where you have people in our community who may not have the access or the time to access specific information. So we want to make it easier for our community members to access the information. So here's Healthy Happy Hour. And because of COVID, we want to make sure that we can keep Healthy Happy Hour alive. So that's why we're virtual. So thank you for joining us. Thank you for rocking with us. And remember, please subscribe to our Neighborhood Medical Center YouTube channel. Like this video, comment, subscribe. You can also listen to it on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, all those different platforms. And of course, check out our website at www.nmcpodcast.com. All right, so today, we got a great one for you today because we are giving you great information about school health and COVID and how to navigate these school health COVID streets. So we brought in a family member. This time we brought in a family member. She's a nurse who studied at the Florida A&M University. So you come from that Rattler school, you're gonna be good. She's worked in the health field for a while. She has great roots and great genes because she comes from a great person who is always also in the nursing field and in the health field. So it's like one of those things where the apple don't fall too far from the tree, and it's a good tree and it's a good apple, right? And so we set this up because this young lady has experience working in the community, working in school health, working in our communities. She's a part of our community. She's someone who you can see on a regular basis. She's accessible, she's knowledgeable, she's resourceful, and she's definitely going to be somebody who's going to give you the information that you would need to be able to go back to school and be healthy. But also, Matthias, I want you to kind of weigh in on this. This is a family. We can't just get her a regular introduction. You got to give her something special. So tell the people about Miss Sasha Wright. Look at me talking to a million people at one time.
Okay, so yeah, she's a great person. She's also a member of Delta Sigma Theta. She's great in the community. You know what I'm saying? Anywhere that you want to see Miss Sasha, you're gonna see her everywhere. She's always willing to help people. Anytime we call her for any outreach, education, anything, she's right there on top of it. So, you know what I'm saying? She's a family member. She's one who is going to give us a lot of knowledge and education today. And she's out there in the trenches. And you know, me and Joe, we in the trenches. We got to find somebody else that's in the trenches. And right now with COVID-19, she's an expert on it right now for the Leon County Schools because she lives it every day. And so why not listen to somebody who lives it every day and knows what's going on? And now
Right.
she can help us educate everybody else that might not get the same information that we're able to provide.
There you go. So everybody put y'all hands together in person and virtually for Miss Sasha Wright.
Thank you, Joe and Matthias. I have known you guys since 2017, 2018, I believe. You guys were a part of my public health sector at FAMU when we were doing community health. Ever since then, I just have been joined at the hips with neighborhood, especially my mom being a nurse there. So thank you for having me.
No problem.
Today, I was asked to talk about some things that are going on with the public school district, as well as some things that many parents don't know about when it comes to school health and nursing in that sector. So I did provide some information for you guys in a presentation for those that are visual.
Okay.
1 second, I'll pull that up. Okay, do you guys see that?
Yes.
Okay, so like Joe said, I did graduate from the Florida A&M University. I also currently attend the University of West Florida, their family nurse practitioner program, and I work as a school health nurse for the Leon County Health Department. I just want to cover exactly what it is that we do with the school health division, how we serve the school district and public health and all. So the school health division is contracted with the school district to provide certain employees, such as school clinic aides. These clinic aides work in the elementary and middle school sections of the public schools. They provide basic first aid care, and they are trained by us to do so. They also provide medication administration and things like that for students that come to the clinic or need to come to the clinic on a daily basis. We also have licensed practical nurses. They go in and they help cover the clinics that do not have an aide for that day. We also have registered nurses who take about 4 to 6 schools per year and are basically in charge of the students' care at that school. We also have our nursing director, Colleen McClellan, who also manages the high school plans and anyone that has medical diagnoses in those areas. So school health nursing, we are comprised of a lot of things. So the number one most important thing that families aren't aware of is that we also provide a support system for any of the students that are diagnosed newly or can have a diagnosis that will continue on lifelong wise. We prepare those students, especially those with diabetes, learn how to manage their diabetes on a daily basis and learn how to, live with that long term. We also are able to do first aid and things like emergency medications for students that might have allergies, for things like tree nuts or things that some students, seasonal allergies, or might require an EpiPen in an emergency situation. We also keep plans on file for anyone that has a general medical condition, who may have seizures that may lead to an emergency where a diastat may be needed, or for those students that are diagnosed with asthma and may need an inhaler on a daily basis or as needed as well. So we also provide a service for students that are diagnosed with ADHD or ADD that may need to take their medication while at school or in the afternoon, for those parents that aren't able to, give that medication during that time. We also are responsible for public school screenings in some of the charter schools as well. So every year we go in and we screen kindergartners, first graders, third graders, and sixth graders with vision, hearing, BMI, scoliosis based on what grade level they are in. With that, we also will refer those students that may fail their vision test or their hearing test so that they can go and get the help that they need. We also provide staff training for the Leon County Public School system, as well as charter schools and private schools, if they need their staffs trained with medication administration or emergency health issues, as well as those individual teachers that will have students in their classroom who may be diabetics or may be asthmatic and need more resources or information on how to handle their care or notice when their symptoms come up. We also do growth and development classes. So for any classes at different schools that they feel the students need more education on health-wise, we come in from a professional standpoint and are able to give those students what they need, do some activities with them. We also work with the Tallahassee Police Department every year as well. And then we also provide IEP and 504 plan support for parents that are needing a nurse to help back them for any recommendations their student may need in the school system. We are able to join in on those meetings and provide feedback and any recommendations we think that student might need to help them be successful in the school year,
Okay, so I did not know that school health nurses did all of this.
Yes, we do. And I'm still learning. I've been employed for a year now, but I'm still learning the ins and outs, and we are growing every year with the things that we are offering.
Right. Because like when you said diabetes management, you blew my mind there. Like I'm still stuck there, and you've said so much since then. But you help kids get the vision and hearing screenings as well?
Yes, we do. So every school year we have the mass screening. Of course, with COVID last year, we were able to do the Title I schools and get them completed, because sometimes those students might lack the services, or parents may not have the insurance to go and get something done like this. Or for those, like the guidance counselors will refer them over to us who they feel they aren't getting that resource at home. So we provide that. Yeah.
No, that's awesome. That's awesome. I'm glad you're here.
Yeah, so there's a lot of things that people don't know about. Even coming in, I wasn't very aware, as well as, everything that they provide. And then with the high schools, when I was in high school, because I'm from this area, Tallahassee area, we didn't have a nurse, and we didn't have a clinic, and we didn't have those
Right.
things. So to know that there is someone that is still over their care, and that they'll never go without someone being there, or someone professionally in the health field being there for them, and it's a free service,
Right.
that's important.
Yes, ma'am.
Yes. So for those that are not aware, I know we serve a number of your children and patients there, especially those that may be diagnosed by the pediatricians that see you guys. If they do need a school health form, these medical plans can be found on the school district's website under school health forms. You will turn that into your school's clinic, and we will take care of you there. Another service that I was so proud of in helping coordinate is the TDAP vaccine clinics. We learned during COVID that that students weren't being able to get in when they needed to with the primary care providers, and the TDAP vaccines that the sixth graders are needing to go to seventh grade. So last year, I was able to coordinate with the public school middle schools in helping them get the students the TDAP vaccines while they were at school. So it wasn't something that the parent may have to take off work to do, or worry about when a primary would be open, or if the health department would be open. We were able to go in if they turned in all of their permission forms and get them their TDAP vaccine. So the next school year, they were able to start on time. So for any of your students or patients that are wanting to participate this year, just have them sign up through their school's listserv, and we will make sure that they get their vaccinations in school.
Okay, just so we clear,
Mm-hmm.
what does TDAP stand for?
It is the tetanus, diphtheria, and pertussis immunization. Most of everyone has to get these vaccines at different stages in their age group. So the 6th dose is the last dose before a student will go to the 7th grade, and then every 10 years after that, they'll get that tetanus shot.
Gotcha.
So it's very important to get that. A lot of times the parents may forget about them, or forget about going annually to the doctor. These are things that help prevent things like lockjaw and any other diseases that may affect the student long term.
Gotcha. Okay, because when we was growing up, it just gotta get your tetanus shot, but
Right.
the TDAP, I'm like, but see all the 17-letter medical words, no.
Yes, so TDAP is, they put it all in together into one
Gotcha.
shot. So
Gotcha.
we make sure that these students that are going to the 6th grade every year have what they need. And we saw such a lack of resources there with students being able to get in because of COVID. So with that, I was able to coordinate this, and then we will start to provide this service annually.
Okay, cool.
All right. Another service that I was so lucky to be a part of is coordinating the summer health fairs for students that are needing immunizations, to catch up on those things, as well as any annual physicals and sports physicals. The best thing about this resource is that it is free. We teamed up with FSU Primary Health and FSU Med School to provide these services for students. This allowed students that weren't able to be seen during the school year because of COVID to get in, get what they need, have a second chance at getting that TDAP shot, have another chance at registering for school, because a lot of providers were not able to do annual physicals recently. So we will start to provide this service annually to help those new to the county and who aren't able to get in with a regular primary doctor. Okay. So for any of them, your students that want to join that opportunity during the summertime, it's a great way to connect with other individuals. We will have sponsorships there in the upcoming years. They can sign up through listserv, and the schools will send this information out every summer.
See, I'm happy that you have so many ways that makes it easier for the parents and the students to connect with the nurses, because I'm just sitting here thinking, I don't even know what our school nurse looked like. I don't even know. When I was in school, I didn't even know how to access the school nurses, because literally, if we got hurt, we just pretended like we didn't, because we didn't want to go home and get in trouble.
Mm-hmm.
So
we
I'm
went to the
really
principal
happy.
office and called our moms and dads to come pick us up. I never met the school nurse.
Right.
I didn't get a Band-Aid. I didn't get a
Right.
pack of ice. I didn't get to lay down because my stomach hurt. So
Exactly.
it is great that I'm able to see this. And when I'm in the clinic, I currently am in charge of 5 schools. I'm able to see those students come in, and they actually see that a nurse can do more than just see them, at a doctor's office.
Right.
Right.
Right. But I appreciate that you're using similar experiences to us. So you were thinking back about your experience as a student, and you're making it better for the students who are there now to say, hey, I am your nurse and I am here to help you, rather than us having to go on the scavenger hunt to find you.
Right, exactly. And my students that have diabetes, I make sure I meet with them personally and not just the clinic aides, so that they know they have several resources and people to talk to, whether it be in school or out of school, they have my information.
Right.
Another way that you can contact me or the school health team if you have any questions about immunization requirements or student health information, whether it be for a private or public school, you can email the Leon School Health at flhealth.gov inbox. So I was also asked to discuss exactly what the school district is doing about COVID-19. How are they navigating this year, as it was very different last year. We no longer have that digital academy. We no longer have, all of the resources from last year. So carrying on to this year, there are different requirements that, as we're still navigating together, what's the best decisions with COVID, resources we have here. So one thing that Leon County Schools recently started was the PCR testing, because with Bragg opening up their doors, it has driven a lot of people to go since the schools has started back. I'm sorry. And with school starting back, it has been like a long line for students to get in. So we want to make sure that the parents feel like they have that resource to go ahead, several places to test, and not feel that they are crammed at one place or have to wait so long to do so. So this is a flyer that explains for the public school students, if you want testing completed, or parents, if you want to get your child tested because of an exposure or just for regular, routine testing. There are drive-through sites that were set up with the city of Tallahassee through the libraries and the community centers here. This information can also be found on the Leon County School District website.
Mhm.
And also for the employees as well. So teachers, if you have any patients that are teachers, and this is a helpful resource too, so that they aren't, waiting to be tested at other locations.
Well, that's good. Sasha, I got a quick question.
Yes.
With that, are they able to send those results to the school, or do they have to get the results from the testing site to go back? How does that work if a kid say you call me and say my child was exposed? How does that work? Like, what happens?
So if you call and say your child is exposed, well, if a school administrator were to call and let you know that your child was exposed, and we'll get into this, there are certain procedures and policies that, from that standpoint, a student would follow. Same thing if they were to come out of school, and I think I had that on the next slide. Yes. If they were out of school and they were exposed at home, there are certain ways that school is called a COVID czar for each school. They have one, and they will tell you exactly what you need to do from that standpoint, and how long you may need to quarantine for, and what your options are. So as of right now, they are temporarily requiring masks. The opt-out form was due on August 16th, but you can still contact your school's administrator in case you feel that your child it still qualifies for opting out of wearing a mask. They do revisit these policies frequently, so don't be afraid in thinking that all year long it will be a requirement, or you feel other students aren't wearing their masks. We're waiting with the governor to see what things will come about of it. Currently, there are no visitors that are allowed the first 9 weeks. So the screenings that we normally would do in the beginning of the school year, they will take place after the visitor hold is lifted. So if you feel like your student needs to be screened immediately, just let your school administrator know, and they will contact the school nurse. So for anyone that tests positive, it is important to go ahead and let your school administrator know. And if your student is exposed at school, your school administrator will contact you and also let you know. So for exposures, they have come up with some different options. So for those that are fully vaccinated, 12 and up, and are fully vaccinated within the last 90 days, they are not required to quarantine nor test. They can continue going to school. For those that elect to test, they have to complete at least a 4-day quarantine, and they may test with a rapid or PCR on the 5th day of their quarantine. On that 5th day, if they are negative and they get that result back, they can return to school on that same day. Of course, if they are also asymptomatic. So for our students that are, or parents that are not wanting to test their children, that is completely okay. It's just a 7-day quarantine. And then if your student is asymptomatic, they may return to school on that 8th day. So the process and how they identify who has been exposed to a positive case is basically who may have been sitting within that student's 6 feet or more for greater than 15 minutes, whether they're wearing a mask or not. This includes on the bus. We also contact trace for the bus. If students are 2 rows ahead or 1 row behind, they are required to quarantine as well. And they will go based off of the date that person tested positive, or 48 hours before that person had symptoms. So the policies changed. Last year was different, but as more information comes out through CDC, they are trying their best to work with TMH doctors to make the best decisions for the students.
Gotcha.
Okay. Any questions about those policies? I know it's a little tricky.
No, I think that's good. I just I'm just glad that they're addressing the mask issue and,
Yes.
and trying to, you know what I'm saying, hopefully people do, you know what I'm saying, even if they don't make the mandate, please, parents, please stress to your kids to keep this mask on. It's very important, especially for the younger kids who are under the age of 12 who can't qualify for this vaccine yet. We're seeing a lot more younger people that are contracting this virus. So we really want to make sure that parents, you do understand. I understand that some, you know what I'm saying, just make the informed decision for yourself to understand that your child needs to wear this mask. And we're really pushing for it. So it don't need to be a man. It needs to be something from the parents to say, hey, make sure you keep your mask on.
Exactly. Right. I completely agree. It is best safe practice to wear a mask, whether you are vaccinated or not. That surely decreases your chances of getting COVID. So in the public schools, we are seeing students with symptoms coming to school. So any of the symptoms listed here, whether it be headache, stomach ache, fatigue, diarrhea, nausea, vomiting, sore throat, chills, a fever of 100.4 or above, runny or congested nose, loss of taste or smell, or shortness of breath or difficulty breathing, we are sending those students home. It's too early to tell whether or not it is flu, whether it's just a common cold. So the fact that we have our regular students coming through the clinic that take daily medications or may have diagnoses such as diabetes, it is important that we are sending those students home, because we don't want to, complicate things for the students that are coming there for daily service or whose immune system is already compromised because of a diagnosis they have. So if they're coming to our school clinics, it is a requirement that they do wear a mask inside the clinic with our clinic aides, especially if there are other students around. And if they are opted out of wearing a mask, the school administrator will have an area for that student to wait to be picked up.
Okay.
Last year, we did so fortunate enough have the COVID room. So the students were being sent to a COVID room separate from the clinic. We did not project this year to be as it is currently with the Delta variant. So this is our measure of how we're trying to keep not only the clinic aide safe, but all of the other students coming through as normal traffic.
So a question, because I know everybody isn't on the same page across the board with the mask mandate. Right. So there are still students who may be in the classrooms with no mask on.
If they have turned in the opted out form, and that's reviewed by the administrator, and that administrator verifies that, then yes, there may be students in classes without a mask.
But you have to
health reasons, but they have to have documentation in order to.
Okay, all right. So that's what I was getting at. For one, making sure that there's a documentation, and so they have to complete the opt-out form. But
yes, which is due on the 16th. Now, again, if there's a special situation or a student may have a certain diagnosis, they have to talk to that administrator about whether that mask can be opted out.
Gotcha. You answered my question then.
Okay.
All right.
So getting into our most contagious variant yet, the Delta variant, it is more widespread. So for those that have been vaccinated, it may help a little bit more with symptoms if you were to contract the COVID-19 Delta variant virus. Symptoms may be less severe. We are seeing breakthrough cases where parents or students that have been vaccinated are getting sick. So, of course, you want to make sure that you're still doing the proper things like wearing a mask and disinfecting, whether you have been vaccinated or not. And CDC is still recommending that you do wear a mask inside. So that has not lifted at all. Their recommendations haven't changed as far as that. And just today, CDC released that there may be booster shots to be considered in the fall for everyone and not just the compromised immune systems, those that have other diagnoses right now. So we will be looking at a third shot soon, which will hopefully help combat and have some, fighting power against this Delta variant.
I'm ready for my shot.
I'm ready to. As soon as I check every day, as soon as they tell me I can get it, I will be right there at you guys' door.
You know it. I'm ready. I'm so
Right.
ready. And it sounds crazy, but I'm ready.
Yes, me too.
It don't sound crazy.
Because anything to do to prevent it, and that's what we want people to understand, and that's why I think Joe and I have kind of switched more of our focus on COVID right now. Is just because it's about prevention, and
Right.
vaccines are prevention. Even though some people say, oh, it wasn't approved by the FDA, it wasn't this, it wasn't that, it's not this, but it's about prevention, and we need to be
Right.
able to trust and say, hey, these scientists, they've been working on this stuff for a long time. It might not
Right.
be out in the open and knowledgeable for everybody to know that they're working on stuff, but believe it or not, they're working on things in labs that we haven't even seen yet that's going to come up later. So we really want people to understand, like, the vaccine is safe. A lot of people have gotten this vaccine and nothing has happened to them. They're not implanting chips. They're not
I haven't grown an extra arm yet, so
Look, I don't
have
have none of my superpowers yet. So
I wish I could be like Joe's favorite character, Blank Man, and get my, my stuff up. But I just really want y'all to understand out there, like, it's important that we get this vaccine, so therefore we can stop this vaccine from mutating.
Right. Well, one thing, like you were saying, and we want people to understand, the study of coronavirus is not new to any of our scientists.
Exactly.
Coronavirus has been around at least 30 years. Coronavirus itself has been around. Now, the COVID-19 is the new aspect, but the base of it, they've been studying. So I know a lot of people are like, well, the vaccine isn't safe because it was rushed. It was still approved for emergency use. Yes, it came faster than they wanted to, but they had all the information they needed. They had all the studies and things they needed because they have already studied coronavirus over years.
Try to combat. Yes, exactly. I was fortunate enough to talk to high school students and present to them exactly what the COVID vaccine is, because you have your parents and then you have your students not understanding exactly what it is, or hearing it from not just a media standpoint or social media, but someone like a nurse who can speak to them directly and answer their questions that they may have. So Rickards High School, they allowed me to come in, present to different classes of 12th graders and those that were old enough to make some of the decisions that are 18 and up on their own about whether or not they should get that vaccine. So I did explain to them, you get vaccinations as a child, and there's reasons why those vaccinations are required and are in place. So same thing with COVID. This is more serious in a sense that people are dying, and then nowadays children are dying. So I think they are getting a handle and understanding, because so much misinformation comes about when they're just reading social media. Most children aren't watching the news anymore or reading articles or research that they're supposed to.
Right.
So some safest practices that CDC has put out over and over is that the first way to try to prevent contracting COVID-19 is getting the vaccination. So if they are 12 and up, they can get that. We're still waiting for that age group to increase. Also wearing a mask indoors, maintaining that social distancing factor. We've heard that some of that distance may shrink depending on, they're still doing a study on that. as well as teaching healthy habits at home. So it starts at home. What you teach your child at home, they take to school. So washing your hands frequently after you're eating, after you're using the restroom, before you even do an activity, after you're taking the garbage out. There's things that you can start doing at home to make sure that they are safe when they leave the home and when they're at school. Even packing hand sanitizer, some teachers will allow them to frequently use that in the classroom. And then things like disinfecting and cleaning at home is a huge issue, especially electronics. We forget a lot of times that our phone, we take that everywhere with us. It's at home, it's outside of the home, it's in school, it's at work, and we're picking up so many germs and taking that home even after we've washed our hands. So that's a very important part that a lot of parents forget about. Washing clothing items after you use them, especially for younger students, they go to school and they're exposed to so much. It's very important that they don't rewear those items. They wash it properly, and also removing the shoes. I've seen that you can track so much coming from out of the house into the home. So if you're removing your shoes at the door, you're not tracking those germs through the house or your bedroom, or potentially where you lay your head. So it's very important to remember to take those shoes off before you actually come into your home, your kitchen, and your bathroom. So for those that are living or quarantining with those that may be on quarantine or are COVID positive, it has been possible for people to still live at home with some of these people that are diagnosed. It's the matter of how you clean and how you maintain your social distance. It is important from CDC standpoint that you are eating and sleeping in a separate room. That you are not sharing household items, that you are disinfecting the kitchen and bathroom after each use, especially with gloves, and then also that you are wearing a mask around infected persons and keeping that 6 feet distance at home. So it is very possible. You just have to be very aware of what you're doing at home, what you're touching at home, and you're still caring for that person, but you have to protect yourself and the potential people that you might expose if you're an essential worker as well.
Okay, I got a question for that. So say I'm a child and say I attend Leon County Schools, but my mom and dad got COVID, but I don't. What do I, just to, reiterate, because I know you went through it earlier today, but what does that child need to do as far as school? They still have to quarantine even though they have a negative test? Because they're living at home with them, or?
For younger students per se, those that actually depend on their parent to eat, sleep, do all of the basic needs, traveling, things like that, they would be considered a close contact. So they would have to follow that quarantine measure that the school has set for them. The school will determine whether or not they see fit, if it's a middle schooler or a high schooler, that they're not having contact with that parent and they are able to continue on their daily going to school measures without being infected or spreading. So normally, if a parent tests positive, the student is still considered a close contact. Most parents, if they are more concerned with the health of others, they will keep that student home during their time at being home, just to make sure that they're not carrying that with them on their clothes or their hands and things like that. So.
Okay, and I got one question. You might not be able to answer this, but I just want to try to figure it out. So, like, what happens to the kid, if they out for 14 days or 10 days? What happens to the schoolwork? Is the school got preparations and things for them so they can get their work done? Because me as a parent would be like, is my child going to be held back because he got COVID? Is he going to miss the grades? You know what I'm saying? So especially for college, when you get in, for high school, when you're getting prepared to go to college, if you get that, are you able to make up that work and all those other things? So do you know anything? Because you might not be able to answer that because we're talking about school.
Yes. So for those that are contacted by the school, the administrator already knows that that student will be out for a period of time. So they ask the parent, what they are thinking, if they're going to test the student, how long they'll expect to be out for, and they'll get that information and all of the education resources that they need from the actual teacher themselves. So that teacher will provide that student with everything that they will need for the time frame that they are expected to be out.
Okay. Good.
Cool.
Good.
Yes, and if it's a case where they are exposed at home or outside of the home, it is important for the parents to let that administrator know, so that administrator will contact the teacher and the teacher is aware. And that's also goes hand in hand with excusing their absences and making sure that they're attending the required amount of days of school, before another service or DCF has to step in and figure out what's going on.
Okay.
Gotcha.
Yeah, so it's a lot of the responsibility does fall on the parent, but as long as they're maintaining that communication with their school, they will have what they need.
Okay, good. Because that was my main concern. Because I know, saying with COVID, everybody's, saying panicking and stuff, and it's just like, are they gonna be able to make up the stuff that happens? Do they have to make up extra days, go to summer school? Those type of things, you look at, especially when you have children.
Right, yeah, that is a big concern. I would want to make sure that they're getting every lesson. Some students, they stay with the same teacher. If they're in elementary school, they're getting language arts, math, all in one. So they have assessed all of the possible issues that they could run into, and they have been addressing that. So I do applaud them for doing that.
Okay,
That's good.
Yes. So for students that may test positive, it is important for the parents to encourage them to eat, to drink fluids, to rest, to not have them go back earlier than they feel they can. Sometimes symptoms are gone, but you're still tired or you're still fatigued, and there's a recovery that you just need to get. And resting is probably the number one thing I would advise the parents to let the students do. The second thing is, if there are medications that you would want your child to take or think that you want to help more, do contact a primary care doctor first, because some of the medications that they may take at home might not help with the virus. Another thing is monitor those symptoms, because you have to seek medical attention. Some things that you do want to watch out for is if your student is having a very hard time breathing, especially if they're already asthmatic, you want to make sure they're getting the oxygen, that amount of oxygen that their body needs throughout their body. You want to call 911 or go seek attention from a hospital if they're having like chest pain. That may be a sign of something more serious going on. Or if they're having new onset confusion, that means that their oxygen levels could be very low and they need only equipment that a hospital could provide. So international U.S. traveling, we do have the Labor Day holiday coming up, and it is very important that we use our discretion and decide what is important to go to and what you should stay home, during this time, especially with the Delta variant. You want to make sure that you are getting PCR tested if you do plan to travel, whether it be on a flight, cruise, or car. You want to test after you come from traveling as well, whether you're vaccinated or not. You don't want to travel if you're having symptoms. Same thing as don't send your student to school if they're having symptoms. You don't know if it's a common cold. You don't know if it's just their allergies, so if the symptoms are present, stay home. And if you know of an exposure or you think you may have been exposed after you travel, quarantine, So some vaccination sites that we do have for the students that are 12 and up, they can go to the Leon County Health Department. That is RNS Clinic, located on Old Bainbridge Road across from Griffin Middle School. You do have Neighborhood Medical Center. Florida A&M has moved their testing and vaccination over to the Ardelia Court area. You have CareRx Pharmacy, Publix, Walmart, Walgreens, CVS, Sam's Club. There are a plethora of resources to get this vaccination. There are no excuses as to why you weren't able to get it. There are health resources that you can call if you need a ride to get that done. So please, if you have a student that is 12 and up, it is in their best interest that they are vaccinated. So all of the information that I have provided today is based on CDC's current guidelines. If you need more information, please feel free to visit the site. And as a disclaimer, for private facilities and for businesses such as the public school district, charter schools, or any healthcare facilities, they can plan to either use CDC's policies or adopt their own regarding COVID-19.
All right, you heard that, YouTube. This is from CDC, so we don't want no mess, YouTube. All right.
All right, CDC.
But Excellent presentation.
Thank you.
Very
Excellent
good. Very
information.
good.
Definitely information that's needed, especially the protocols and everything that goes with testing, and if somebody may be exposed or somebody
Right.
may actually have COVID, people know the protocols. That's definitely going to be clipped out and made to a clip, put on Instagram and different places, so people can
Right.
see that. But what's the for somebody? Let's say you have parents who have children starting school, or you have parents that may not just have been that involved.
Mhm.
What are some ways that parents can get more information,
And stay in
who
the
may
loop.
not who may not see this, but somebody else may see this and can give the information? What would be a simple way, a phone number or something that
Mhm.
parents could call to get more information?
Definitely contact your school. Each school has a COVID czar, and that
Okay.
czar is in charge of letting parents know guidelines to things as far as COVID, what they are expected to do when they're in school and when they're out of school. They also help with just any information or any questions that they may have. You can also join listserv with the whatever school your child attends. Principals and the school administrators will constantly put out updated policies and guidelines there. Even the school district website, they have content, they have information there. But for general information or questions, or if you're wondering about anything, I would go directly to CDC's website as they stay in the loop.
Okay. Y'all heard that, people. Look, if we do our best to make sure you all get the best information, and today we fulfilled our mission.
No,
So
well, I thank you guys for providing the podcast and moving with the times, because we do have people that do like to listen or do need a visual aside from ABC News and all of these other
yeah,
media channels, especially in the
yeah,
local community. You want to hear from people that you trust. So
exactly,
thank you for
exactly.
having me today. This was
Oh, no
such a
problem.
pleasure in doing, and I would love to come back again.
You more than welcome back. Like I say, you family, so you're more than welcome back. We definitely would like to work with you more and be able to get more information. And
Mhm.
so you already know we're gonna stay in touch. Thank you,
Thank
everybody.
you.
This is another healthy happy hour.
Mhm.
Remember, NMC NMCpodcast.com, Neighborhood Medical Center YouTube. Subscribe, share the video, comment, tell a friend to tell a friend. Especially you in this Leon County area, this is information that you need for your children to keep them safe. So do yourself a favor and use this information. So I'm Joseph Ward. Shout out to Matthias. He had to run. Nurse Sasha Wright. We appreciate you, and we see you guys next time for Happy Happy Hour. Peace
Thank
out.
you.